Hello, hello to all the angels out there. We are bringing you a special presentation today. I have the honor of talking with the esteemed medical doctor, Mr. Darren Naugles. We are going to share with you some insights to help clear up the confusion that's been going on out there about COVID lately. What are we supposed to do? Should we wear masks? Should we not wear masks? What type of therapeutics are out there for us? How's this virus really working or spreading against us? And how many more variants are there that we could expect? In fact, I think the basic question everyone has is, when will we return to normal, right? So today we are going to stay focused a little bit on 2+ years since COVID. Now what? But before we jump into the COVID conversation, I want to tell you a little bit to introduce my very special guest. I am pleased to call him a friend, and he is a board certified emergency medicine physician and also a fellow in anti-aging medicine and functional and integrative medicine specialist in metabolic and functional medicine. And as we all know, in today's world, it is all about natural health and integrative medicine and functional medicine. I'm one, being from Jamaica, really believe in natural herbs and CBD and everything. So I really am happy to talk to Dr. Darren, because he is also the co-founder and program director for Elite Medical Associates, which is a center that offers natural and holistic approach to medicine. We're going to hear from him today because he has an advanced approach. He targets the root cause of issues and early risk factors to promote the highest expression of health in all of his patients through cutting-edge testing and personalized one-on-one appointments. So he is going to make sure you get the right amount of individual care that you so greatly deserve. He's not going to rush you in and out from the ER when you get to an ER or so forth, right? So he's going to give you the right amount of attention and make sure he gets right down to the root causes and diagnose everything. So when you leave, you are healthy and well, which is everybody's goal. All right. So he's committed to transforming healthcare with the purpose of achieving the most natural form of health and wellness for his patients. And I, being the CEO and founder of Angels Are Networking, who's host many summits during the year, particularly my favorite is the Angels Health and Wellness and Fitness and Beauty Summit. So I am really big on healthy living and holistic living and natural living and staying COVID-free as much as possible and taking vaccines and preventing COVID. So with that, I thank you again, Dr. Darren, for taking time out of your busy schedule to be with us here.
First of all, I like what you said earlier. People have their whole perception of emergency medicine, and when they do come to the emergency department, what to expect. One of the things that they expect, patients do expect when they come to the emergency department, which is a false theory, is that they're going to get in and out and the doctors aren't going to be well explained to the patient about what they're here for, and that we don't take time. But I think that all changed about 2 years ago when I started to really, I've been in emergency medicine for 20 years, so I've taken care of some of the sickest people from straight out of the womb to up to 100. I like when you said that, I take my time when patients do come to the emergency department, because underlying all those medical conditions, what's the problem is their way of life. They're not eating right. They're more stressful. They don't know how to eat. They don't know how to take care of themselves. So I spend that extra 5 to 10 minutes at the end. Actually, me and the patient will break down and cry because it's very sensitive, because ignorance is amazing when it comes to patients not knowing what to do and what they're doing wrong. And to break in for a patient, look at me and say, Dr. Naugles, nobody's ever cared about that much to really sit down and tell me these are the things that I'm doing wrong in life. And then they break down and cry. And I'm a very, I try to hold my tears. That's just my heart. I have a heart to help people. And you can't, if you have a heart to help people, it's hard to hold back sometimes. I love to hear that patient say, wow, thank you. Nobody's ever done that for me. Hard to say. And, Fauci, he's the person who's head of CDC. He really explained it the best about the whole COVID. Everybody say, are we out of the pandemic? Are we
Yeah.
still in the pandemic?
Yeah.
Well, the world is still in a pandemic. They just had a new variant called the Deltatron. It's now showing an increase in this new variant called Deltatron in parts of Europe, like France, Denmark, Germany. So as long as there's still areas of the world, because that's what a pandemic means. Pandemic means that a disease has transcended borders. So as long as there's countries and these areas that are popping up, we're still in a pandemic. But Fauci explains it well when he says that we are in a pandemic, but we are not in a full-blown explosive pandemic. Meaning what we were seeing back in, year or two ago, wherein you had millions of cases popping up, deaths, thousands of deaths occurring from this. Yeah, we've gone beyond that, but we're still in a pandemic. And he termed the phase like a transitional pandemic phase. And this is a phase where the numbers are decelerating and the numbers become more controlled. And that's the point. The pandemic, it may not go away, but if we can control the numbers, control the amount of how people get sick, then it's almost like a controlled pandemic state, almost like kind of like an endemic. Pandemic is when a disease transcends borders. So it starts in China and then it starts to transcend beyond borders, countries. Epidemic is when the disease or the infection is geographically in one location and it's out of control. An example of an epidemic is our opioid epidemic. What the opioids are doing to this country may not be doing it globally, but to this country, it's destroying young kids. What's the difference between that and an endemic? An endemic is where it's in a geographical place, but it's controlled. There are certain diseases out there that happen in certain regions of the country, so we can predict when it's going to happen and we can control it. So that's where we are kind of in COVID, is that it's almost in an endemic phase. They're still popping up in areas, but we can predict and we can control. Where are we predicting that these areas are concentrated in? Mainly in areas where people don't get vaccinated. Yeah. I think in the present and in the possible near future, but if you were to ask me 2-3 years from now, are we going to still be in a pandemic? I can't predict that. Hopefully we were not, but at this phase, the world is still in a pandemic, but you can classify certain regions of the world that it may be transitional, meaning that it's a control, it's decelerating. You're not seeing that many cases pop up. You're not seeing that many illnesses. You're still seeing COVID in this country, but it's not on a wide mass level like it was a year or two ago. A year ago, 2 years ago, we were like, and I hate to describe it in this metaphor, but we were like ignorance on fire, meaning we didn't know what we were doing. So we were like, everybody needs to be tested. And I was okay with that because we didn't know anything about it. But we evolved into this. Now we understand the disease more. So we can be very selective on who needs to test and who does not need to test. Okay. So that's where we're at now. The tests are still important and they give us a lot of information, but are we screaming for everybody to go get tested? No. First, we have to kind of break it down. There's two types of tests. The two types of tests are molecular tests, which is the PCR. That's the gold standard. That's the test that will give you the greatest yield of accuracy. And that's what we're really looking for. And then there's the antigen test, which is the rapid test. It's the test where you can take at home or you can go to the hospital and take. You can go take it at a minute clinic, okay? But anytime you're dealing with testing, you take in consideration what's the accuracy of that test. And when you look at the accuracy, you want to know two things. How accurate is it going to be able to tell us somebody has the disease versus, and how accurate it's going to get for somebody for it to tell us if somebody doesn't have the disease. So the antigen test is reliable. It's highly reliable when you test positive. Okay, meaning that when you test positive, it has like almost a 99% accuracy rate. This molecular test has a high accuracy, meaning that if it's negative, its accuracy is 96% chance that it's right. If it's positive, it has a 99% chance that it's right. The difference with the antigen test is, yeah, if you test positive, it's 99% reliable. However, if you test negative, it's only in studies, it says that it's 64% live. So you're taking if it's 64% chance accurate, then you're taking a chance that 36% of the time you're going to get a test that is false. And what we determine is basically we're really looking at the false negatives, because remember, it's very reliable, so there's a low chance that there's going to be a false positive, meaning that you have it, you test positive, but you don't really mean it, meaning that 99% of the chance you test positive, you're going to be positive. But in a rapid negative test, you're going to have 36% of that chance you're going to be true positive, but it's saying negative. There's things that can change their accuracy. It's shown that if somebody takes a rapid test and they've had the symptoms within 1 to 3 days of the start of symptoms, their accuracy goes up to 96%. Okay. If you don't have symptoms, your accuracy is 58%. And that's all dealing with viral load. So if you don't have symptoms and you test negative, then it's likely probably that you're negative. But if you have symptoms and you test negative, then you should go get a confirmatory test.